is climate change affecting people's health? It's really great to see so many of you joining us today. My name's Leah Davis. I'm Head of Policy and External Affairs here at New Philanthropy Capital, NPC. Now, today's event is being recorded and it's going to be made available after the event on NPC's website. And we're also going to be live tweeting. So if you want to join in on that, please do use the hashtag HealthyPlanetNPC. That's HealthyPlanetNPC if you want to be part of that. We're really pleased to be able to host the event today, looking at how climate and other environmental changes are affecting people's health. And importantly, what funders who don't traditionally fund environmental programs can do about it. I think COP26 at the end of last year was quite hard to miss. It was all over the media, and it really did bring some focus on the need for more urgent action on climate change. And really that climate action can no longer just be the niche of a handful of small environmental or even large environmental charities. If we're going to tackle it, we're going to need to have action from across society. And that's because climate and nature crises are going to affect us all, but particularly those who are already suffering some of the greatest disadvantages, whether that's here or whether that's further afield. And we think that charities are going to be a really important part of the changes that we need to make. They have amazing reach into their communities and people from all different walks of life. And here at NPC, we've been working with charities from across the social and environmental sectors for the past year to understand what role they can play in tackling the climate crises. And we're hearing that many charities and funders really want to be part of the solution, but many just don't know what the impacts will be on the people that they serve. And with funding squeezes on the charity sector over the past few years, and with many just focusing, I think quite rightly, on what's happening with COVID and how it's affecting the people they're there to serve. I think many charities have really been struggling to prioritise any kind of meaningful action on the environmental crisis. And we also know, I think, one of the big challenges is that the funding is just isn't coming through to tackle and pay for some of the programmes that are going to need to be run. So we're going to hear from, in a moment, the Environmental Funders Network, and their research showed that only 6% of UK foundation funding is going to environmental causes. Now that's up from previous years, but it's not even really likely to touch the sides of what we're going to need to do and what we need to do now. So that's why we're really excited to be able to hold this event today, to be part of some of the efforts to support charities and their funders to better understand the impacts of the nature crises in one area, which is people's health. But this is a really important area because health obviously affects all of us, but as you'll hear in a moment, it also affects different groups quite differently. So we've got some really great speakers you're going to hear from today. You're going to be hearing from Jane Gabouti, who is the Environmental Funders Network's Growing Philanthropy Director. And she's going to tell us a bit more about the work that EFN have been doing to highlight the wider implications of the environmental crises outside the traditional environmental sphere. You're also going to be hearing from NPC's Principal for Effective Philanthropy, Liz Gadd, who's been working with the support of Jane and EFN to develop a briefing called Healthy Planet, Healthy People, which we published last week, and which summarises the health impacts of our changing climate, as well as other nature and pollution crises. And finally, you're going to be hearing from Hugh Mehta, who is Philanthropy and Partnerships Manager at the Children's Investment Fund Foundation, or CIFF, and will be giving his perspective on how CIFF as a funder has been thinking about how to have some of the most impact through funding both health and climate solutions. Now, we're going to have a Q&A session after our speakers, where you'll be able to put your questions to them. So if you do think of questions as they're speaking, please do add them to the chat and we will collate them towards the end. And you'll also have the option, if you prefer to ask the question yourself, you can use the raised hand button function. You can use that as well. Now, the event is in your diaries for an hour and a half. We've left loads of time for Q&A, but we're anticipating it might finish a little bit earlier, which we hope will give you some much appreciated time back in your diaries. So now, without further ado, I'm going to hand over to our first speaker, Jane Gabouti, who is going to say a bit more about the work that EFN has been doing to lead in this area. Jane runs a programme of work at EFN to increase the amount of financial support for the environmental causes. Prior to joining EFN, she worked for over 20 years in fundraising roles for a wide range of organisations, including the Wildlife Trust, NSPCC and Oxfam, so knows the charity sector well. So Jane, over to you.
Thank you, Leah. Hello, everyone. I'm delighted to be here today and to see so many of you here. Thank you, MPC, for organising and hosting this event. As Leah said, I work for the Environmental Funders Network. We're the UK's network for foundations and individual donors who support environmental causes. And we've got two aims: to grow the amount of funding for the environment. Like Leah said, it's very underfunded, although that funding is growing, and to improve its overall effectiveness, so make the funding that does go to environmental causes as effective as it possibly can be. We welcome any funder with an interest in the environment at our meetings and events, so you don't have to be already funding the environment, just have an interest in it. And we produce research and other publications to support funders to start giving to environmental causes and to be effective in their grant making. And we also have a strand of work that aims to strengthen the environmental sector itself, so we work very closely with environmental NGOs. We often say that the name of our organisation is a misnomer because you can't separate the environment out from any aspect of human life. It provides life support for us. It's the air we breathe, the water we drink, the food we grow, and the natural systems, both climate and ecological, they protect our very ways of being. So our meetings and events and publications often explore the intersections of the environment with other social issues, and nowhere are these connections more pronounced than with our own health. It's like an enormous complex web. There are safe environmental limits within which human life can flourish, but as we know, humanity is increasingly crossing those limits, and it's dramatically affecting people's health and lives right now, right around the world, and incurring additional costs for the health sector. So it follows that fighting climate change and nature loss will reduce these adverse health outcomes. And yet, as Leah has already said, so little philanthropic funding is directed towards the environment. The 6% that Leah mentioned, that's from UK foundations going to environmental causes. It's about 2% when you look at climate change, and it's a very similar picture around the world. So we've been running a series called Healthy Planet, Healthy People, which explores these many interconnections between human health and the environment. And it demonstrates why supporting environmental work, or why and how supporting environmental work, can lead to significant positive health and social outcomes. There'll be a link in the chat, but the series started last summer, and after a series introduction with some brilliant speakers, we've run some meetings and events, and we've recorded those, some podcasts, we've had some blogs written on different topics at this intersection, like mental health, air pollution, infectious diseases, toxics and pollutants. And we've worked in collaboration with a lot of other organisations and experts and scientists on these different topics. Our aim was to go beyond the environmental funding sector and really engage with health and social funders to see where we can all begin to work together and to collaborate. And then it's been an absolute pleasure to work with MPC on the philanthropy briefing that accompanies this series, and we'll hear more about that shortly. Thank you. I really wanted to say thank you to MPC, particularly Liz and Leah, for doing such a great job on the briefing. I think you've created a really logical, practical and absolutely fascinating guide out of this web of health and environmental interconnections. Thank you also to CIFF for sponsoring the publication, as it wouldn't have been possible without your support. So that's all for now. Look forward to answering any questions later in the Q&A, and back to Leah.
Great, thank you so much, Jane. And yeah, well, I'm actually going to hand over now to Liz, who's actually going to tell you more about the briefing that Jane just mentioned. So Liz is MPC's Principal for Effective Philanthropy. She's got a background of over 20 years working in charities in the UK and overseas. She's also trustee of the Pesticide Action Network and the Environmental Funders Network. And as Jane mentioned, together, Liz and I lead on MPC's work collaborating with charities at the intersection of social and environmental issues. So over to you, Liz.
Thank you, Leah, and good morning, everybody. So I'm going to talk you through some of the key findings of MPC and EFM's Healthy Planet, Healthy People briefing. We found a strong and growing evidence base that environmental degradation has a significant impact on human health. And despite this, as you've been hearing, only 6% of funding from UK trusts and foundations going to such environmental work. So I'm going to talk you through a few of the ways in which we can see those changes and how you can help. We're all aware that our climate is heating, and you're probably aware that governments have committed to limiting that global heating in order to minimise the impacts of climate change. So we're all aiming for no more than a 1.5 degree rise above pre-industrial levels. However, we're on track for at least a 3 degree rise. And with this change in our climate, we are increasingly experiencing heat waves, droughts, intense rainfall and flooding. And these climatic changes then go on to intersect with wider human-caused environmental damage, things like air pollutions, toxic pollutions in land and on water, as well as loss of green spaces and loss of biodiversity, and the damage that we're creating to our seas and oceans. So the climate and nature crises are intertwining to affect the health of the planet and in turn our own health and well-being. And the environment shapes our health in more ways than you might expect, from Alzheimer's to asthma, Parkinson's to premature labour, as well as cancer, obesity, infectious diseases, and many more. And the people impacted are equally varied. And as is sadly often the case, it's the most vulnerable in our communities who are the most affected by the environmental determinants of ill health. These are also the same people who have the most gain from protecting the environment and in turn our health. I'm going to take you through a few of the areas in the briefing to look in a little more detail. Climate change is increasing global temperatures, and with that comes risks of droughts. This is already causing health impacts, which are only going to get worse without greater and more urgent action to cut carbon emissions and to help people and communities to adapt to the increasing temperatures already baked in. The Lancet Planetary Health Journal reports that excess deaths from what they call non-optimal temperatures accounts for almost 10% of global deaths. And the countries around the equator are at the most risk. However, here in the UK, even a 1 degree rise above the average daily temperature sees more than 2% more deaths. In addition, drought can lead to wildfires, which we saw globally and here in the UK last summer. Wildfires increase air pollution, which then brings further respiratory and cardiovascular problems. And the changes in temperatures are also affecting the patterns and prevalences of disease. And we've already seen the expansion of areas at risk of diseases like malaria, dengue, and other diseases affected in the same way. The impact of rising temperatures is felt unequally between and within countries. So we'll see that younger and older people are often the most vulnerable to increased heat, as are pregnant women, those living with physical or mental health conditions. And also in urban areas, the temperatures can be 10 degrees hotter than surrounding countryside. However, on the plus side, having green space in urban areas can mitigate those risks. For example, urban parks are on average 1 degree cooler than the rest of the city in both day and night time. And that cooling effect can spread up to a surprising 1 kilometre from the park boundary. Those who are in poorly adapted housing in urban areas are even further at risk. And that is already, 1 in 5 houses in England, even before temperatures start to climb further. Rising temperatures will also see rainfall patterns continue to change. We can expect more precipitation in some areas, for example, near the equator, And in other regions, for example, the Mediterranean, we're likely to see a decrease in rain. But where there is rainfall in all locations, we can expect that rainfall to become more intense. And that's a pattern we're already seeing in the UK. The more intense periods of rainfall, especially when you combine that with poorly managed land and drainage, leads to increased flooding. Globally, for island states and other low-lying areas, limiting the temperature rises and associated flooding make the difference between survival or submersion. And in the UK and other Western countries, we can expect to see more flooding in vulnerable areas. In the UK, that's currently 1 in 6 properties, some 5 million people at risk of flooding. Increased rainfall and flooding brings health risks like waterborne diseases, such as the rotavirus, which causes gastroenteritis, as well as flood-related injuries. And the wider impacts of natural disasters can affect food production, energy availability, and all of the physical and mental health issues that a lack of life's essentials precipitate. And the least privileged are frequently the hardest hit. For example, you might recall seeing in the press that when New York experienced flooding last summer, almost all of those who died were poorer people living in basement flats. Climate change and air pollution are often described as 2 sides of the same coin. The substances that cause air pollution come from many of the same sources as greenhouse gas emissions, or in fact, greenhouse gas emissions themselves. Globally, there's a shocking 90% of us breathing unhealthy air at the moment. And that leads to approximately 7 million deaths a year attributed to air pollution. That pollution causes a high proportion of death and disease from lung cancer, respiratory infections, stroke, heart disease, chronic obstructive pulmonary disease, and more. And there are early indicators that air pollution is linked to things that we're only just becoming aware of, like links to childhood obesity and also growth impairment known as stunting, which affects approximately 59 million children in South Asia and a further 58 million in sub-Saharan Africa. Air pollution's also linked to mental health conditions, causing increasing prevalence and severity of mental health issues. Low and middle income countries bear the greatest burden of air pollution. And within developed countries such as the UK, it's those living in urban areas, again, often the least privileged, who are worst affected. Indeed, Professor Marmot's Health Inequalities Review found that air pollution plays a really significant role in worsening health inequalities in the UK. For example, 85% of people living with illegal levels of nitrogen oxide were also in the poorest 1/5 of the population. People with existing health conditions are particularly vulnerable to air pollution, which often includes older people. And there are a myriad of statistics on the increased risk of hospital admissions, development of dementia, etc. Yet over 1/4 of care homes in England are located in areas with levels of fine particulate matter, air pollution, that's higher than those recommended by the World Health Organization. And similarly, children and pregnant women are also particularly vulnerable, with links to lifelong health issues. And yet, a child is born into polluted air every 2 minutes in the UK. And 1.3 million children across the country are in schools within areas that breach the World Health Organization's air pollution limits. As humans, we're reducing green space across our planet, and we're reducing the diversity of flora and fauna within the remaining green spaces. And biodiversity protects us from infectious diseases through what's known as the dilution effect. And with less biodiversity, we see more and greater prevalence of infectious diseases. 60% of all of infectious diseases, and as much as 3/4 of emerging infectious diseases, a zoonotic. That is to say, diseases caused by bacteria and viruses spreading between animals and humans. And zoonotic diseases include things like COVID-19, HIV, malaria, some strains of flu. And destructions of our natural ecosystems, along with poorly regulated trade in wildlife, brings us increased risk of such illnesses. Importantly, also playing a significant role in biodiversity loss, of which global food production is a very key driver. Factory farming, especially that of livestock, is contributing to global heating, and rising levels of CO2, as well as chemicals used on land, are reducing the nutritional value of our food. For example, factory farmed meat has been shown to have higher omega-6 and lower omega-3 levels than non-factory farmed meat. An inadequate intake of omega-3, and also the imbalance of omega-3 and omega-6 when that's inadequate, has been linked to cardiovascular disease, cancer, and obesity. And similarly, intensive arable farming also has health effects. It reduces our soil health, which in turn reduces the nutrients in our food. So just as one example, magnesium in our food is decreasing, and lower levels of magnesium have been linked to depression, osteoporosis, fatigue, muscle weakness, high blood pressure, and asthma. 95% of our food comes either directly or indirectly from the soil. So our soil health is way more important to us than many realise. Factory farming of livestock can also contribute to the spread of disease. For example, battery cage farms are 6 times more likely than non-caged farms to be infected with the type of salmonella that's most commonly associated with food poisoning. And farm animals often provide the bridge for zoonotic diseases to make that jump from wildlife to humans. Similarly, intensive dairy farming poses all sorts of questions around bovine leukemia virus. Milk is gathered in pooled milk tanks, and between 83 and 100% of dairy operations test positive for bovine leukemia antibodies that's put into those pooled milk tanks. And whilst currently the transmission routes are unclear, we know that the odds of humans developing breast cancer if they're BVL positive is 3.1 times greater than if they're BVL negative, which is higher than any of the frequently published risk factors for breast cancer, things we commonly hear about being obesity, alcohol consumption, and postmenopausal hormones. Toxics from industrial, domestic, and agricultural activities are polluting the natural world and causing a myriad and absolutely extensive list of health issues. Just as a couple of examples, there's a link between pesticide use and ADHD, depression, anxiety, Parkinson's, and cancer. Or if you look at polluted water, causing things like gastroenteritis, ear, eye, chest, throat, and skin infections where sewage is released into our water systems. But perhaps the most dangerous health impacts are via what's known as the cocktail effect, where we're exposed to many different chemicals simultaneously via our food, our water, air, and indeed common household problems. Absolutely everyone is affected by toxics in our land and water, and there's much yet we don't understand sufficiently, particularly around those most affected. For example, better understanding the impacts on pregnant women, babies, children, and young people. This morning, I've touched upon just a really small number of examples of the links between our health and the environment. And our briefing for funders provides a wealth of further information, as well as resources to support you to take the next steps. It's important to note, though, that the environmental determinants of health and all of the associated health and social inequalities alongside that are emerging areas of understanding and practice. Just in the last few days alone, here are a few of the headlines as people are starting to explore and understand these issues better. So support for charities from across the environmental and social sectors to respond for the health of people and planet has quite literally never been more important. With this slide, I'm just going to speak to the funders in the room for a moment, but for any charities listening, please continue to be champions in your charity, speaking to funders, raising issues with trustees, understanding how these issues affect the communities and the people that you serve, and getting those important messages out to those communities as well as your funders. Funders can make a massive difference. Here are just 5 key ways that you could take your next steps. So firstly, understanding how environmental factors affect the health of people that you serve, whether that's through helping existing grantees to understand what the environmental crises mean for them, whether that's helping environmental charities drive transformative work, or whether as a health or social issue funder, you can play a really critical role in helping to prevent issues from falling through the gaps. In MPC, our experience is that the intersection of social and environmental issues is highly underfunded, and siloed funding streams risk intersectional issues and challenges and communities affected falling through the gaps, which is something you can play a role in helping. Secondly, you can use your investments to support environmental work, and the briefing provides some useful links, some brilliant case studies for work already underway to help you to do just that. Thirdly, you can consider innovative financing alongside grant making, and you may wish to have a look at the Esme Fairbairn Foundation's exciting new programme in partnership with EFN here today to enable funders to explore innovative finance alongside their experienced staff team. That's their Environmental Finance and Learning Fund. You can also green your operations, number 4, and support your grantees to do that as well. Again, more information in the briefing. And 5th and finally, I'd encourage you to sign up to the funder commitment on climate change or the newly launched individual philanthropists commitment on climate change. Whatever causes you care about and already support will undoubtedly be impacted by climate change. And your engagement with the intersection of health and environmental issues can make a transformative difference. So for more information, have a look at MPC and EFN's new resource, and also the fabulous wider resources within the EFN funders, Environmental Funders Network's Healthy Planet, Healthy People series. Thank you, everybody.
Thank you, Liz. Really, as Liz mentioned, I'd really encourage you to take a look at that report. It's got lots of information in there, but we put a handy guide at the beginning to help you kind of see which bits of it would be relevant to you. So yeah, please do take a look after the event. We're now going to hear from our next speaker, which is Hugh Mehta. For over 15 years, Hugh has raised funds and guided partnerships for international conservation, health and child rights organisations. And before moving into philanthropy, Hugh worked for UNICEF UK, WWF and Sightsavers. But he's now with the Children's Investment Fund Foundation, where he focuses on scaling up philanthropic funding for climate change solutions. So Hugh, over to you.
Sorry, just doing the typical thing of not being able to find the unmute button, but there now. So firstly, I just wanted to say a massive thank you to Liz and Leah and the team at MPC and also to the team at EFN for putting together this really compelling and excellent report and the presentation that you've just heard. I don't think it's a huge surprise to anyone on this call that nature's good for the soul. However, what this report really does is cleanly draw the links between the need to protect our planet and the benefits that that's going to bring to our own physical health and mental well-being. So I've been asked to say a few words about CIFF and why we as a children's foundation are so active in protecting the planet and mitigating the impacts of climate change. Well, starting with the facts, I guess CIFF, or the Children's Investment Fund Foundation, was established in 2002. And we like to say that we're the world's largest foundation that's focusing specifically on improving child lives. Last year, we granted over $300 million from our offices in London, Nairobi, Addis Ababa, Delhi and Beijing. And our portfolio splits roughly into two parts. So firstly, we have our direct work for and with children and young people. And that includes work on child health and development, adolescent sexual and reproductive health, equality for girls, and child protection. And then on the other side of our portfolio, we have our climate change investments. And we make those investments because we firmly believe that climate change is the biggest threat that children are facing now and in the future. And we're not the only ones to think that way. UNICEF recently released a report that said approximately 1 billion children, that's nearly half of all children in the world, live in countries that are at extremely high risk to climate change. And it's a sad but true fact, as we've heard from the report, that children born today are breathing more polluted air than we did as children, and certainly far more than our parents did. And that's thanks to our own behaviour. And it's that behaviour that is also driving climate change. So children are facing much higher rates of things like wildfire, droughts, floods, and heat waves. And it's all being driven by our changing climate. So CIFF's early work 2 decades ago focused on malnutrition in developing countries, particularly sub-Saharan Africa. And here it quickly became apparent that environmental changes were causing serious problems to the programs that we cared about and funded. So climate change was and still is driving recurring and significant droughts. And simplistically, that causes water scarcity, which in turn causes crop failure and in turn drives up rates of malnutrition. And these changing weather patterns, as we already heard as well, are forcing the change of, and spread of deadly diseases into places where they didn't exist before. They're also causing people to migrate in ways that they might not have done, which brings with it a whole host of other issues, including child protection. And all of these things together are just putting children at greater risk. So these issues really became apparent to our founder, Sir Christopher Hahn, who's often quoted as saying that he wants to solve problems, not just give grants. And it became clear to CIFF and to Chris that if you really want to help people escape poverty, well, you've got to be an environmentalist and you have to tackle climate change. So CIFF got going relatively slowly when we began our climate journey back in 2010. To start with, climate change was a small special project, but over the last 12 years, it's developed, as I said earlier, into about half of our overall work. Initially, we started on trying to stop coal, which remains the dirtiest and most polluting industry in the world. It's contributing massively to global warming, despite good measures recently announced at COP26. And coal really still drives human ill health and early death in many cases. Over the time, we've taken on more sectors and more priorities, including investing into promoting renewable energy, work on air quality, transport, cities, industry, and work on land use and food systems and the way we produce food to feed our planet. And alongside this sector work, we invest quite heavily into cross-cutting solutions and tactical approaches. So we fund work on climate diplomacy, strategic litigation, finance engagement, but also communications and campaigns, which are creating that demand for change that we really need to see. And as one of the world's biggest climate funders, we support programs that deliver global results, but also that go deep into priority regions for us. So CIFF is based here in the UK and, well, our headquarters is, sorry. And that means that we really want to help Europe to continue to be a climate leader, whilst focusing on places like China and India and Southeast Asia, where the opportunities, but also the risks around climate change remain huge. So at the heart of all of this work is a recognition that we really want to mitigate climate change to create a world that's better for children. A healthy climate really will significantly improve life chances for the kids that we want to protect. And we all know, I think, very clearly that now is the time for action. We're already late, and the science has been telling us for a long time. And actually now this report it also usefully really does demonstrate that we have to act. But in acting, there are significant and huge co-benefits for us if we safeguard the planet. And a lot of that comes back to our own health. The Intergovernmental Panel on Climate Change, or IPCC for short, has been very clear actually that we've got to keep temperature rises to below 1.5 degrees to avert the most catastrophic effects of climate, but also to prevent health impacts and to prevent millions of untimely deaths thanks to climate. Yet, as a world and a society, we're really not delivering the funding that's needed to meet the scale of the challenge, either from governments, corporates, or whoever really. And we know that philanthropy's got an important role to play here. We can't provide all of the funding that's needed to fix the climate crisis, but we can provide funding that has catalytic effects. You know, we've got the flexibility and the independence to take risks and fund things that governments and companies can't or won't, such as pushing for greater ambition. And whilst philanthropy does have this really important role to play, the numbers still aren't stacking up in terms of our contributions. We heard earlier from Jane that less than 6% of foundation funding here in the UK goes to environmental causes. And actually that 6% climate is a subsection underneath it as well. And globally, less than 2% of philanthropy goes to mitigating climate change. These numbers just aren't commensurate with the climate crisis, but also with the potential wins for our health and society if we do start to invest at a scale that really fits the size of the challenge. I'll stop there. Thanks. Pass back to you, Leah.
Thanks so much, Hugh. Really fascinating on how your kind of journey actually, and how as a funder you thought about it over time. I'm sure it's going to spur quite a few questions. So we're now going to move into the Q&A stage. So we've got Liz and Jane and Hugh are here to answer any of your questions. So if you've got them, please do put them in the chat. Also feel free to raise your hand as well, and I'll try and spot them on my screen. But just while people are having to think about those questions, I'm going to take the chair's prerogative and ask one of my own questions to start off with. So I guess my first question would be, if you were, there's been lots of hype. So COP obviously there was lots of media attention around it at the end of the year. It feels like quite a lot of that's gone now. The kind of hype has gone, and you know, in the mainstream media certainly largely disappeared. So what role do you think that we, you know, I was just looking in the chat and I was seeing all the different views and why people have joined today and why they think climate change is important. It really varies. We've all got very different missions. So what do you think that charities and funders can do to kind of keep up that awareness, either within their own organisations or more broadly? And that's to anyone who wants to jump in first.
I'm happy to, Leah, to jump in first. I know I was really encouraged by all the coverage of COP and how it was all over the media, and there was so much interest in it. And then, like you say, it did seem to just drop immediately as soon as COP finished. But I think to understand why and what we can do, we have to look into some of the reasons for that. And I think immediately COP finished in mid-November, we went into another series of crises, certainly here in the UK. Omicron raised its head not long after, and then people started worrying about whether there would be more deaths, impacts on the economy, you know, what that would mean for us, whether our health service would be overwhelmed. And there were other crises like the A&E crisis and energy prices really starting to rise. So I think the media and us, you know, the public, we're not very good at looking beyond those immediate crises. And you do have to look slightly more long term when you're thinking about climate and nature loss, although, you know, time is running out. We haven't got very long now. And in the UK, we're not yet, for the most part, living with the effects of climate change like some other countries are. So it's kind of hard to see over the horizon. But I think charities and funders can keep the conversation alive and keep the pressure on, hold governments to account for the promises that they did make at COP, keep campaigning and lobbying, find creative ways of getting climate change and nature loss into the media, and raising awareness of the impacts that is going to have on social causes and our health is really important to that. And conversations like the one we're having today are enormously helpful. So I think, you know, we know that philanthropy makes an enormous difference to the environment and then consequently our health. So I think just, you know, keep raising the profile, doing what you can, bring funding to the table as well.
Great, thank you, Jane. And is there, Liz, Hugh, any kind of thoughts on that question as well?
Building on what Jane's saying, for me, one of the most powerful things that we can do in the charity and funding sector is to draw attention to the intersectionality of the issues. You know, it can be quite easy to sort of push environmental issues as something that happens over there in another place by other people, too more distant than the sort of end of the month challenges that we're often thinking about. But all of those things intersect with the environmental crises, and it's a win-win for both social and environmental issues to be addressing some of these challenges more intersectionally. And our social issue charities and funders in the sector have such an enormously important role to play in doing that, because we are frequently in touch with some of the most vulnerable people in the country, helping with a wide range of issues, able to empower them to understand the impact and what they need to do, and also empowering others to understand how we can protect the most vulnerable in our society.
Thanks, Liz.
So I don't have a great deal more to add. I agree there has been an upsurge in noise around climate, which was really helpful and much needed around COP26. And yes, that may not be there in the mainstream media as much as we want it to be, and we do need to keep pushing for that. However, at the same time, it's kickstarted conversations like this one that we're having today, really important. You know that climate will be being talked about in corporate boardrooms around the world, increasingly so, and we need to maintain the pressure to make sure that continues to happen. And it's becoming an issue that is broader than the environment, and I think that's really important. So people are really starting to get that climate change affects everything, and we need ministries around the world beyond environment ministries to be looking at this and paying close attention and to invest in resources. And it feels like we're getting there, and it does feel like that there is progress, although obviously not in comparison to the challenge we face. And the other thing I'd say is that we're building now to COP27 in Egypt, and COP27, hopefully it won't be another quiet one. You know, we've got this ratchet mechanism, so countries are being asked to come back with bigger commitments and to really outline how they're going to meet the commitments that are being made as well. So fingers crossed that that will be another moment in November where we continue to get some of this pressure. And then in terms of what funders and charities can do, it's keep doing everything you're doing, as Jane and Liz have rightly said. The thing about climate is that we need to do everything everywhere. You know, it's not something that we can stop working on. It affects our air, it affects our jobs, it affects society, it affects our health, as this report's really clearly saying. So it's just a kind of a plug to keep going.
Thanks. So it feels like there's a kind of sense of both the need for kind of charities to there are points. So we're going to have another COP. So, you know, COP26 might go on, but it feels like there will be momentum in other places that maybe charities and funders can use. And it feels just like, yeah, that you know, kind of scale, anything we can do would be helpful at this stage. So I guess following on from that, Liz, you've obviously spent a lot of time going through a lot of evidence of the health impacts. And there's huge amounts of evidence. I mean, if you look in that report, just the kind of footnotes and all the references are pages long, because there's just so much out there. So if you are a charity, let's say, and you want to start working on this area, what would be your point of where to start? What would your advice be as a starting point?
Oh, such a good question, Leah. Anyone would be forgiven for feeling slightly overwhelmed with the enormity and complexity of these interwoven issues. I think my advice would be to start with your own expertise, start close to home. Think about the issues you're currently funding or the communities you're currently supporting, and how the environmental crises intersect, particularly thinking about health as one of the major intersections. You can build on your expertise, your existing relationships with your grantees, with people with lived experience, to explore together how you can take your next steps. Now, section 3 in the report on how to take action gives you some pointers on things you might like to think about for those next steps. So just as a couple of examples, thinking about What could you do within your current strategy and the work that you're already doing? But then when you're ready to take the next step, what could you do in future strategies when it comes time to refresh what you're doing as an organisation? What more could you build in to think about the climate and nature crises intersection with your mission and your focus areas? There are also a few other suggestions in there, for example, looking at these questions through a diversity, equity and inclusion lens. So again, sort of coming back to this idea of multiple disadvantage and how it's the most vulnerable people who will be the hardest hit in the UK and overseas, and that where your identity includes multiple reasons why you might be disadvantaged or minoritized, you are ever further at risk. And so also a really critical way that you can start to think about your first steps and who might need your help the most within the areas that you're currently looking at.
Great, thank you, Liz. I think it's really helpful advice. We've had a question come in from the audience. So Claire Rooney from the University of Bristol, thank you for your question. It's a question for Hugh, which is, how is CIFF's experience of grant making in this sphere playing out in terms of striking the balance between supporting direct action against the need to establish an evidence base seeking to influence policy? So that's direct action versus the kind of evidence base and influencing policy. How was your approach to this evolved?
Yeah, it's a really good question. I think, well, there's a couple of things to say here. I mean, as I said earlier on, we got going quite early on coal, and a lot of that was direct action and a lot of campaign work there. But CIFF, as a funder, we put a huge emphasis on evidence, learning and monitoring and evaluation, and it really informs all of the programs that we do, and increasingly so. And so with all of our investments, there's a real thorough evidence gathering exercise that goes on at the start. And then we monitor as we go through routinely, and we course correct, and we make sure that that balance, I guess, between the different interventions is struck well. The other thing I'd say, so CIFF, being a large funder, and like a lot of the other large global funders, we've invested in setting up regional foundations that can lead work locally. So CIFF and other funders established the European Climate Foundation. We're doing the same at the moment in the African Climate Foundation. And these organisations are really important, I think, to help strike that balance, as you say, because we really firmly believe in recruiting local experts with local links to policymakers and regulators and businesses that can then actually deliver the work for us. So we talk a lot about our regranters. Really, they're our partners. They're the experts that are funded in a kind of wholesale way. So about 50% of our funding actually goes to these regional foundations that are then much better placed to make sure that work is delivered in a systematic and thoughtful and very, very strategic way.
That's really helpful, thank you. I think yeah, one of the things is around, and I guess this is sort of some ways related to the next question, but it feels like there's and it's to do with like where knowledge lies and who knows about these things. So it feels like there's a lot of evidence out there about the health impacts. I mean, it's hard to sometimes scale how big the impact is in a different geographic region. So some of the kind of disease and infections that we talked about will be higher in some areas than others, but generally it feels like there's quite a low level of knowledge within the kind of social sector, but maybe even more broadly within the health profession and society about some of these impacts. Why do you think that is? That goes to everyone.
We'll being polite and seeing who's going to unmute first. I think we do have a tendency to generally work in silos, and because all of the needs are so pressing, so the health and social needs are so pressing, the environmental needs are so pressing. So again, going back to long-term and short-term, there can be a short-term focus on those needs, and the funding goes to very much solving those short-term needs. So we do need to just take a step back and start working in collaboration more with other sectors, because there are these co-benefits as we've discussed. not just in terms of the environment, but for our health as well. So Liz talked about air pollution and mental health, and even small increases in nitrogen dioxide lead to increases in people having to go to their doctor and be hospitalized because of mental health problems. So if we can work together and tackle air pollution, which will also have an effect on climate change, which will also have a very direct effect on mental health, and save some of the efforts having to be made at the other end of the line, that there's benefits all round. And just using the air pollution example, philanthropy has played a really key role in that, in terms of driving through low emission zones in cities, all the way along that happening. Philanthropy has played a really key role. So again, I think it's just about having these conversations. That's why we developed the Healthy Planet, Healthy People series, to engage with health and social funders, so we could combine our knowledge and start working together a bit more.
Great, and it does feel like those areas where we as a kind of group have managed to talk about the co-benefits of things. So why environmental action is going to improve health has been air quality is a great example of where that's been quite successful. Liz and Hugh, did either of you want to come in on that question?
So I think the point around collaboration is really well made. I don't think it's necessarily a problem about awareness. I think awareness really is growing around the benefits and co-benefits of protecting the environment. But I think, like all resource-strapped organisations, you have to tend to focus on treating the immediate symptoms of things and focusing there, whereas what we're asking people to do, I guess, to some extent, with the intersection of health and environment, is to step back and thinking about some of the root causes and some of the way we can invest as a kind of preventative medicine, I guess, for a better phrase, and trying to really stop things becoming the problems that they are. But as I say, resources are what they are, and it means that sometimes you do have to focus on the immediate threats and issues.
Great, thank you. Liz, did you want to come in at all on that?
I'll let Sheila go ahead.
Oh, thank you. I did a report before I joined the David Hume Institute a couple of years ago about delivering social care at home in the face of increasing extreme and adverse weather, and that was for Climate Exchange and the Scottish Government. And what I found really shocking, and I think is relevant to charities that are involved in delivery of services, is the health and social care partnerships in Scotland had very little and sometimes nothing at all about the impacts of climate change in their strategies. And therefore, they would not be showing leadership in terms of working with those charities that deliver services to make sure, for example, the funding package covered what might need to be done. And in this case, it was just simple things like, if you've got people dependent on social care at home, but you've got increasing floods or increasing, icy weather or whatever it is, you've just got more extreme weather, how do carers driving clapped out vehicles, because they're on low incomes, get to those people? And, there were lots and lots of issues that were actually quite small scale and day to day that are already affecting people in the UK. They're just not there in those overarching strategies. And so I do think, while charities have to do something, there is also another something we probably have to do, which is put pressure on the commissioning sector to actually really be thinking about this and take it into account. And I did that research at the beginning of the pandemic, and there were a lot of excuses pre-pandemic as to why it wasn't an issue they were thinking about now. So pressure of funding, we've got to sort out social care, it's a big issue. So I imagine that will have been pushed back even further by the pandemic, which is another reason. So I'm kind of interested in what you think sort of charities roll up collectively in pushing not just philanthropic funders, but the kind of public money to move in a direction that helps us actually address these things.
Who would like to say that one? Liz, are you going to go first?
Had some really important points, and I think the answer is the same, really, whether you're speaking to a commissioning body or a funding body, and that is in maximising the expertise on the ground. whether that's the people directly affected in communities, whether that's the supporting organisations, the frontline staff in charities across the country, who are seeing all of those interconnections on a day-to-day basis and enabling the system behind them to be able to empower them and fund them and support them with the resources that they need in all its myriad of ways to be able to address those challenges. And the net result of that will be much greater impact and much more effective use of resources.
Thank you. Jane or Hugh, did you want to come in on that question?
Just briefly, I guess one thing that funders can think about is really investing in pilot programs that show what good looks like, so that can then drive the public purse. And hopefully there's good proposals and thoughts out there. It sounds like you've done some fantastic work in the past.
Thank you, Hugh.
I
Jane?
can't really add anything to that there. And there are some good examples. I went to an event last week run by RSPB Scotland, which was about natural prescribing, and it seemed like through that project, which had really good results, that had really helped them to forge links with the medical profession. They're working with GPs, but also other health professionals, and just raising the awareness in Scotland of all of those intersections. So yeah, there is great work going on out there, but agree there needs to be a lot more of it.
Great, thank you. I think that this, the discussion that we're having today is really starting to unearth just what some of the challenges are and some of the solutions, but it still feels like we're actually in quite an early stage, and we need to kind of accelerate action quite quickly. So thank you for definitely for the kind of Q&A and the questions that have come through. And here at MPC, we're really keen to kind of support charities and funders to understand much more about this intersection with health, as well as social issues as well. And as I mentioned at the start of the event, we've been working with charities and funders over the past year, running some roundtables and workshops to understand how we can all work together to get a better understanding of the environmental crises and how it's going to affect different social groups, and what charities and funders need to do about it. And I think our view and that of the partners that we're working with is that we really need to kind of, it's urgent acceleration. And I think, words like that are used quite a lot, but in this case, it feels like it really is true that, without it, it feels like, I think Hugh mentioned earlier, we're already a bit late. So we really need to get a shift on. And I think we need to work together to understand so that charities and funders have a better understanding about how it affects people, but also making sure that those people who are going to be most affected, have their voice raised. And I think charities can play quite an important route to helping to do that. So at the moment at MPC, we are developing a project with partners about how we think we can help to accelerate that. And it's really about how can we make sure that, those people, we understand the impacts on those people and some of the worst impacts that are averted. So I'm going to ask Gillian just to quickly share a slide on kind of what we're doing, because we're definitely at the stage where we're thinking about this. We want to get as many people as possible from the social sector involved in it. So essentially what we're looking at is working with funders and charities across where we think some of those social groups will be most affected, where there's already momentum. So we're looking at developing work within the health sector, those living with particular health conditions, both mental and physical health conditions, children and young people, those living in poor housing, those living in poverty, and also those who are from minority ethnic communities. But it's very much a cross-sector piece of work. This is where we found momentum in the charity sector, but it may well be there's other sectors, for example, people living with disabilities or older people, that there might be a reason to start taking action in those areas. And for each of these strands, what we're looking to do, Gillian, could you switch on to the next slide, please, is firstly just understanding what is the existing evidence about the impact on these different social groups. There's lots of information out there, but it's not gathered in such a way that it's very easily understandable. We then want to ask those people who are directly affected by some of these changes, so the people within those social groups, what do they want to see? How is climate change affecting them, and how are the policies affecting them, as we heard earlier? And what do the changes that we need to see or they want to see? From that, we want to then work to develop new policy approaches and actions that can tackle both social and environmental challenges together. So instead of at the moment, they're quite divorced, bringing them together. And then want to share findings with both charities and other people working across the sector so they can be enabled to take action as well. And then finally, want to see if we can do joint advocacy to government for policy change. We're really at the early stages, and we really want to build on some great work that's already happening in the sector. We know things like Crack the Crises has been bringing together charities to work more on international climate change. There's been great work through the Citizens Assembly and things like IPPR's Environmental Justice Commission. So what we want to do is to help bring some more of that into the charity sector here in the UK. As I said, we're still at really early stages of developing the project. So if you're a charity that wants to get involved or just hear more about where we are with it, or your funder that wants to help support it, please do get in contact with either Liz or I. Next slide, please, Gillian. And there's our contact details if you do want to get in contact with us. But I just wanted to finish off by saying thank you so much for everyone for joining us today. It's great to see so many of you and across such a diverse group of organisations as well. I'd really like to thank all of our speakers today, but particularly the Environmental Funders Network, Jane, for partnering with us on this, and our Healthy Planet, Healthy People report, and also to Hugh and CIFF who sponsored the report. And then finally, to all the people who work behind the scenes on this event and also the report. So Gillian, Rebecca, Emily, Alex, and Will here at MPC, thank you so much for your hard work behind the scenes to make this event and all the work happen as well. Right, our contact details are on the screen if you want to find out more about this project or about some of the other things that both EFN and MPC are working on. And as I said, please do take a look at the report. It's got loads of really useful information in there. Thank you again for joining us today, and enjoy the rest of your day. Thanks.